Congenital heart diseases. A congenital disease is one that is present at birth, but is not necessarily hereditary. Ventricular septal defects. Ventricular septal defects is the most common congenital heart disease. It can an opening that is present at birth in the ventricular septum that allows blood to move back and forth between the ventricles. Interatrial septal defect. In an interatrial septal defect, the foramen of force between the two atria fails to low at birth, and the tri is born with an opening between the right and left atria that allows blood to pass back and forth. The etiology of follow. The etiology of follows is a combination of 4 congenital defects. 1. Ventricular septal defect. 2. Pulmonary stenosis. 3. Enlargement of the right ventricle. 4. Emergence of the aorta from both ventricles. Some forms of congenital heart disease may have no symptoms. They might be suspected by hearing a heart murmur on a routine physical examination. Sometimes symptoms such as poor feeding, shortness of breath, poor throat, frequent pneumonias, sweating, or dusky colored skin lead to the diagnosis. Some forms of congenital heart defects show up as medical emergencies, perhaps with respiratory distress, cardiac distress, or cyanosis. The diagnosis is suspected based on the history and physical exam. Further workup may include studies such as EKGs, chest X-rays, and echocardiograms. The treatment depends on the type of the defect, how severe it is, and a child's age, size, and general health. Vaccination. Adequate intake of folic acid or iodine through fortification of stable foods or supplementation, and adequate antenatal care are just 3 examples of prevention methods for congenital heart disease. Thank you very much.